Hello and welcome to Health Chat, where we have conversations concerning health matters for your better health and well-being. And today we will be having conversations revolving around reproductive health, and we have an honor of hosting a reproductive health expert who will be introducing himself in a short while.
My name is Collins Mishoki.
Yeah.
I am the Reproductive Health and Family Planning Coordinator at Population Services Kenya.
What does this reproductive health coordination involve?
As we are striving to have a better health and well-being for all Kenyans, we are looking at Kenyans all around in an all-round manner. Mm-hmm. And part of health is sexual and reproductive health. Mm-hmm. Here, we are talking about ensuring that Kenyans get the best possible outcomes in terms of their sexual health. Mm-hmm. We are talking here about family planning issues, we're talking about maternal issues, child health issues, and also adolescents. Mm-hmm. Currently, PS Kenya is actually leading one of the biggest family planning programs in Kenya, mm-hmm. known as DESIP. Mm-hmm. DESIP in full is delivering equitable and sustainable increases in family planning in Kenya. Mm-hmm. And DESIP is a very unique program. It actually looks at increasing access to family planning, especially in areas where access is difficult, mm-hmm. like in the arid and semi-arid regions. Yeah. We are looking at the special groups in Kenya, such as people living with disabilities, the adolescents, mm-hmm. and young people, and also those people who inhabit rich areas, such as the poor rural women in some of the counties that we are in. Okay. Some of the unique things we've done in these areas is having interventions such as training community-based distributors. Mm-hmm. These are community health promoters who have had additional trainings, not only to provide family planning information to these communities mm-hmm. who are living in these atrocious areas, but also to provide some of the short-term services uh-huh. and commodities to these communities. Mm-hmm. And also try and link some of them mm-hmm. to the healthcare workers once they get this information. Mm-hmm. Yeah, we are also having our outreaches, which are free for these communities. Uh-huh. And hereby, we actually go to them. Even sometimes we ride on other partners who reach such distances, such as Action Against Hunger in Mandera. Mm-hmm. And you're able to reach these populations here with family planning information and services. Mm-hmm. And this is very important for these communities because, you know, these are the areas where we are seeing high maternal mortalities. Mm-hmm. We are seeing issues with adolescents and teenage pregnancies. And you know, for adolescents, we have to give them the appropriate messages on how to prevent such issues. Mm. And the same areas, these are places where we have problems such as gender-based violence and all that. Mm-hmm. So we are able to reach these people, all this information and the services where they are. Mm.
Yes. And you mentioned working closely with community-based promoters.
Yes.
The distributors that you give them the training mm-hmm. For these particular matters. What is the nature of the training that you give them? Because if they're going to distribute these family planning methods, mm-hmm. then it means they have to be properly informed based on the products that they're supposed to supply mm-hmm. in case people have questions. Mm-hmm. How do you do that?
So what we do is the community health promoters have their own special training, which includes family planning. Mm-hmm. So once they go through this training, they now are able to give messages to the community. Mm. But for them now to become community-based distributors, they need an extra 3-week training, mm-hmm. including an assessment, even by the national government. Yeah. So during the first week of training, they're just taken through the family planning methods, how they are administered and all that. Mm-hmm. In their second week of training, they are attached to hospitals within the training area or in areas that are reachable mm-hmm. from the training site. And here, they are supervised by the trainers, including the national trainers, to ensure that the services they are going to be providing in the future will be quality services. Mm. Now, in their third weeks, they go back to where they normally work, to the community health units where they work. Mm-hmm. Here, they are attached to the facilities and the service providers, monitor and supervise them to ensure that they are able to offer the services that, and they are giving quality, safe services to the communities. Yeah. And this is where they report, and this is where they get the commodities from, mm-hmm. and this is where they get the continuous medical education from mm-hmm. to ensure quality services. And just to bring it that the government has only allowed 14 counties to have CBDs, and this because these are the underserved counties where even DESIP program works in. Yes.
You have mentioned a group of people that the program is interested in. We have talked about the teenagers, we have talked about people who are disadvantaged in terms of availability of resources, the poor. Let's talk about persons with disability. Why do you think it's important to reach out to persons with disability when it comes to reproductive health?
Well, thank you very much for that. So for us, we realize that persons with disability are some of those groups that are sometimes not really considered, even as we make our policies, as we make our programs and so on. And you know, persons with disabilities, just like you and I, also have health needs, including needs for proper quality sexual and reproductive health, including family planning. You see, most of our service providers, or I would say the majority of our service providers, do not have the training to actually work with persons with disabilities. And even when we design our hospitals, when we design our settings, even at the community level, sometimes we don't consider these people. You find in many settings, we don't have ramps for persons using wheelchairs. And even if we have ramps, sometimes they just put there just because we know they're supposed to be there, but we don't consider things such as the gradients of these ramps. Sometimes they're very difficult to climb. It is very interesting because sometimes when you go to these healthcare facilities and you get a client who is deaf, it becomes a problem to communicate with this client. And if this client is to bring in a translator, that by itself even just affects the confidentiality between the client and the service provider. So DESIP has worked together with other organizations such as Voluntary Service Overseas VSO to be able to actually sensitize healthcare workers to be able to understand that we do have these persons with disabilities coming for services, and we do need to consciously make effort to reach out to them with information on family planning and other healthcare services. And when they come to these healthcare facilities, how are we going to work with them?